Which of the following clotting factors is most directly affected by DVT prophylaxis? We know we are talking about anticoagulants. All right. Now, 40-year-old women, severe left upper quadrant pain. Sickle cell anemia. There's a history of sickle cell anemia. She has severe tenderness to the left upper quadrant. Splenomegaly is noted. And when you admit her, she's placed on DVT prophylaxis. Okay. Now, the DVT prophylaxis is such that after it is given, the lab findings show a normal PT but an elevated APTT. Right? So APTT is affected by heparin and PT and INR by warfarin. So these are the investigations that you monitor. When you're giving heparin, you monitor APTT, which influences the intrinsic pathway more. Influences both pathways, but the intrinsic greater, and PT and INR for the extrinsic pathway monitored in warfarin therapy. So we know this patient is being given heparin. What is the mechanism? I'm sorry. So I have this pathway for you. Okay, so factor 7 is included in the extrinsic pathway. That is what goes here. So this entire is the intrinsic pathway. There is an extrinsic pathway. The factor 3, that is thromboplastin, gets activated, and that activates factor 7. Factor 7 further activates thrombin, and then the entire goes. I chose a cascade, but have I removed it in the newer edition or not? Okay, I think it was in the question bank itself. Right, okay. They have the extrinsic pathway here. What happens is tissue factor 3, thromboplastin, that will activate factor 7. Factor 7 will further go on to activate the Stewart's factor, and Stewart's factor will lead to thrombin formation from prothrombin, and thrombin will conduct the rest of the coagulation pathway. So this factor 7 is a part of the extrinsic pathway, and as we know, antithrombin, whose activity is boosted by heparin, majorly affects thrombin and other intrinsic pathway factors, right? So those factors are as given here, right? 7A, 9A, 10A, 11A, and 12A. Okay, right. Okay. So in our case, thrombin is not given as an option. 12A is not affected. 12 and 12 will be ruled out. We know what antithrombin basically does. It is that it stops the prophylaxis, right? So none of the activated factors would be the answer. So we are left with 10 and 2, and hence since 2 is not given in the option, it is 10. 7A is given, right? That is how it affects the extrinsic pathway to some extent. But the thing is that it has a greater activity on factor 10. Wait, I'll just show you. Right, yeah, here. Okay, so it does, antithrombin inhibits thrombin, that is factor 2, a major, right? That is the major action. Apart from that, it also inhibits 7A, 9A, 10, 11, and 12. But the principal target of antithrombin is thrombin and 10A. Okay, so if you're given both the options and you're still doubtful, I would prefer you go for factor 10, right? This is confusing, and 7 and 7A both are given. So what you can do is you could use a little, you could do a smart guess and go for 10. It is ambiguous, but majority of the questions in the exam itself will be. So keep in mind to choose the best possible answer out of all the options that you think are right.
Thanks for watching. Please give a thumbs up and subscribe for more.